I'm about to say something I never thought I would ever say in a million years, but I agree with Marjorie Taylor Greene. Take a look.
Typically a MAGA loyalist, she's broken with the GOP over concerns that her children's health care premiums will double next year.
2 out of the 3 have aged out of being on my insurance. And so you're seeing me being a mom who's frankly really pissed off.
So Marjorie Taylor Greene is upset that her adult children are going to see their health care costs double. They're going to double for her kids. So she is now suddenly very concerned about what she did in that big ugly bill. And let's look at the impacts of this. Let's look at some of the effects of the fragile state of our healthcare in this country and how it will be pushed over the edge by these cuts to the Affordable Care Act and cuts to Medicaid. Here are some headlines.
Rural hospitals in California have reached their financial breaking point, which could leave the state with fewer health care providers and force patients in less populated areas to travel longer distances for care.
Social safety net programs are at risk under President Trump's mega law, which slashes Medicaid and food stamps. An estimated 10 million people are expected to lose their health insurance under the law.
How badly do people actually need this health care and this health insurance from the government?
It's critical. It's the difference between living on the street and under the influence and causing all kinds of problems to being functional.
People who sign up for health insurance through the Affordable Care Act could see their premiums more than double. Federal lawmakers warn those higher prices will be permanent unless Congress reinstates subsidies for the program.
Now, I may agree with Marjorie Taylor Greene on this, but I'm not letting her off the hook because she voted for this. She voted for this. Just about all the Republicans in both houses of Congress voted for this, voted for these cuts to the Affordable Care Act that are doubling people's premiums. I think what she's really objecting to, in addition to the fact it affects her own kids, is the fact that of the top 10 states most adversely impacted, who are going to see the highest spikes in healthcare costs within the next couple months because of the Republican bill, all 10 of those states are red states. Let's look at some of those cost increases. West Virginia will see a 387% increase in premiums. Wyoming will see a 382% spike. Alaska, 346% higher. Tennessee, 320% higher. Mississippi, 314% higher. At least 200% increases for Texas, South Carolina, Alabama, and the Dakotas. This is the effect of the Republicans' own bill. This is why we're sounding the alarm. This is why Marjorie Taylor Greene is speaking out, because now her kids are affected. Now, I see this all the time in Congress. That is, I see colleagues who don't particularly care about the impact of laws or changes in policy on the country, even on their own constituents. It's only when it affects their own family that they seem to give a damn. I don't understand operating that way. I want my kids to have good access to health care, but I want all kids to have good access to health care. I want to make sure that everyone, every family, can get good quality health care in the richest nation on earth. But I think what is most powerful is hearing from the people who are most personally impacted. So I want you to watch this. This is Samantha. She's from Redlands, California. She is a pediatric cancer survivor. I want to have her tell you the impact of healthcare cuts that the Republicans just enacted and what it will mean to her healthcare and millions of others if they go unaddressed.
My name is Samantha. I'm 23 years old and I was diagnosed with osteosarcoma, which is a very rare type of bone cancer at the age of 19. It is considered a pediatric type of cancer, so I was treated pediatrically. I underwent a limb salvage surgery. I had it in my leg, and after that, it left me permanently disabled. So protecting access to healthcare insurance is critically important to me and other kids who have experienced cancer for a multitude of reasons. About half of all kids who have cancer are covered by Medicaid. And because if parents of a kid with cancer have health insurance that doesn't cover their treatment, then falling back on Medicaid or Medicare helps a lot. For me, for example, when I was first diagnosed, my primary insurance was not going to cover my treatment. I'm not sure if you know, but chemotherapy and just treatment in general for cancer is extremely expensive. My family was not going to be able to afford that, and we were going to go into a lot of debt, and my treatment was going to have to be delayed for a significant amount of time. The type of cancer that I had was super aggressive, and I did not have that time. Thankfully, I was paired with a social worker who was able to get me on a plan that now is at risk of being cut. And that plan essentially saved my life, because had I waited any longer to receive treatment, I don't know what the outcome of my treatment would have been, considering it is a very rare and aggressive form of cancer. So I'm about 2 years NED, which is no evidence of disease. And following cancer and, of course, being left permanently disabled, I still rely on Medicare for a lot of the stuff that I need. For example, therapy, physical therapy, medication, scans, like all of that in itself is super expensive. My family and myself at 23 years old cannot afford that extra $1,000 that's being added to what already is expensive, because insurance can only cover so much. So it would greatly impact my journey post-cancer. And I know a lot of people who are currently still in treatment and still having their battle with cancer who would also be directly affected. And at that point, if you can't afford your treatment, then you'd have to halt it, and that's completely unrealistic. And if we're going to sit here and say that we care about all lives, then we need to care about these kids who are on these programs that are keeping them alive, essentially. I would say that it's important to strike a deal and to come to a resolution and come together for this, because specifically for cancer patients and families affected by cancer, it is literally a matter of life or death. Either we can afford our treatment or we can't. Either we can afford the aftermath of cancer or we can't. And there's already, unfortunately, not enough funding for pediatric cancer and childhood cancer research. And unfortunately, that's causing a lot of people to lose their children or their sibling or their friends to cancer, unfortunately. And if we don't allow people access to affordable health care, then what we're doing is limiting their options and essentially shortening the time that they have. Because once you run out of options, and if you can't afford the options that are available to you, then there's really nothing you can do.
So tax cuts for rich people or life-saving treatment for people like Samantha. That is the choice that we faced in the Congress. That is the choice Republicans made when they voted to give that money to rich people and tax cuts and take it away from people like Samantha. It is really as simple and as awful as that. Now, her story, I think, is really powerful and persuasive. And I know there are lots of you out there who have similarly powerful statements to make about how reliant you are on the healthcare system, on Medicaid, and on the Affordable Care Act. So I'm asking you, will you share a video of yourself like Samantha did, explaining how this healthcare debate affects you, affects someone in your family? Because these stories are powerful and the country needs to hear them. And I would also ask this. So one of my colleagues from Georgia, Raphael Warnock, shared on social media the insurance bill that a constituent got last year and the insurance bill they just got. So they've already received their notice in the mail from their marketplace insurance provider about their premiums and how dramatically they're increasing. So I would ask you to do the same thing. These notices are going out all over the country. Some have already gone out, others are going out in the next week or two. So if you would, send me a screenshot of your bill from last year, your invoice. Send me a screenshot of what your new bill looks like. Let me share it with the Congress and the country. You can help decide this debate. You can help save healthcare in this country. Your stories really matter. Please share them. So thanks for watching tonight's video. We started doing these nightly videos as a way of identifying something really important that happened today or this week, what we should make of it, and how we can fight back. Thank you for following along.